Good evening, everyone, and welcome. We're going to do a quick roll call. We've got Emily, Monica, Mary Louise, Bruce, and our co-chairs, Renee and Chris, and Gino and Annie are excused this evening. Did I miss anybody? Sounds like we're good.
Yep.
Okay, great. And so we'll start with communications from our co-chairs. Whoever would like to start, Chris or Renee, go right ahead.
Go ahead, Renee.
Hey everyone, thanks for the adjustment. My internet went down at the office and I was like, oh my gosh, so I had to rush home. So glad to be here with you all. I think the only thing is there's no updates right now that I've heard from Dr. Sanchez, which, just to clarify, Valeria, he doesn't work for the UNM, like he works for the policy group, but he doesn't control the contract process. I think in the message in your notes, it made it sound like he was part of that, but he's waiting as well to find out when UNM finishes the contract review and when it makes it over to us, back to the city. So I haven't heard any updates since the last correspondence. And then the other thing I was going to update is for Friday's meeting, but I'll wait till the working group updates before I share that. And the other thing is, I'm sure you all know that our budget passed. There's a lot of good things in there, and there was a lot of things that I didn't feel like were expensive enough, and where we needed to target our focus of funds. So as you know, I think we talked about last time, the police got a 16% increase, 15,000 signing bonus, and $750,000 down payment assistance for just emergency responders. And Chris and I were trying to expand that to all staff people that would qualify, income qualified staff people, and we were rejected by various people, but the mayor didn't want to make any adjustments. So we're going to keep pushing for that as we look at the mid-year point, and look at the budget and see where we're at. And by then, hopefully we'll have an audit so that we can actually see and know where our expenses and revenues are coming from, and just making sure that we're on track with that. And then also just the other increases, everyone else got 8%, with exception of PD. And so I don't know if, was there anything else, Chris, you wanted to add about that in terms of the budget?
I think, did you already talk about the fire department and requesting more training and personnel to support the ARU? Oh,
I haven't yet. Go ahead.
That's their kind of one of their big asks. They got an 8%, and so did AFSCME, but public safety, I think, got 8, and then police got the larger amount. And I think it was a little ironic that, you know, probably a year ago, everyone's talking about defunding police, and now we seem to be throwing money at them. So, which, you know, I think I think Renee and I both made these arguments, is that we need to retain the officers, otherwise we're going to lose them in droves to state police or to Rio Rancho, because they're offering larger pay, but I don't see that it's really been working. We have more vacancies now than we did before we started this matching everyone's pay raise. So, you know, we have to find ways to do some better recruiting. I think that's the key. So we both made arguments on that, and then they're offering down payment assistance to only public safety for now, to the tune of $750,000. So according to surveys from both, from fire at least, there seemed to be a pretty big interest in down payment assistance, but we'll monitor it throughout the course of 6 months to a year and see if we need to put more money in or if we need to be more inclusive with other employees and kind of watch that and see where it goes.
Thank you, Chris and Renee. Go ahead, Monica, you have a question?
Yes, I just have a couple questions for you guys. First, I also think it's wonderful that you guys advocated for that to be a program for other city employees, because we all have to figure out how to live in Santa Fe. And I have multiple questions. So rather than ask a compound question, I'll just ask them individually, which is, so there's $750,000. Is there a limit to how much, or are they gonna, how do I say this? If somebody applies for it, is it a standard amount or is it a percentage, or how are they gonna distribute that over the year to help officers get housing?
They haven't structured it yet, but I'm assuming it's going to be based on how HomeWise does it now, or the housing trust, which is usually based on your income. It's also, we've noticed that with our down payment assistance funding that it has to be increased because 20,000 was the norm. And now it needs to be probably up to about at least 50,000. So when you think about 50,000, that only serves about 14 people. And that's why we were saying, well, not only should this be accessible to all city employees, because essential workers are in every level, not every level, but every department. And we have more shortages in other departments than we do PD. There's some departments that have 32% vacancies and 40% vacancies. So we need more money in that fund too. 750,000 is not going to go very far. So
Great.
They haven't structured it yet though. That was the other thing. We're like, well, who's going to be facilitating the criteria essentially? So we're probably going to have to work with the nonprofit to be able to structure that for the city.
And the other thing is, HomeWise or who's the other one, Renee? The Housing Trust. They have income levels that people need to qualify. And I'm not sure that our police and fire that they're trying to bring back from other places that have been here making raises and doing getting an income higher and higher every year are going to qualify for those. So maybe good for people just starting, but for those that have been here a while, I'm not sure we're going to bring a lot of people back. So but it's, like I said, we'll keep looking at it and keeping track of it. Marcella, are you waving at me or was it? Oh.
Waving at my coworkers who are leaving.
Yeah.
And I am staying.
Thank
And
you.
then, sorry, just before you go on, Monica, just want to let you know that we did ask about additional funding for this committee. And we're told by Kira that it's in her budget. She has it. And, so we should have enough to do with Gabe what we want to do to the fullest extent possible, I think. And then I think to keep Valeria on board as well.
That's great. Is it also included in her budget? Well, I don't know if this would be included in her budget, because I know that they were saying with the staffing issue that then we would get a staff member from her department to help staff this committee.
Yep.
Cool. The only other question I had was, so I'm assuming that the down payment assistance is, or sort of I'm assuming that some of the argument for it is to try and keep, or to try to keep officers here instead of moving. Mm-hmm. But I hear your point that we already are doing a lot of things to try and keep them here and they're still leaving. And I just, I wonder if I guess that's just more a discussion, I guess, is that, you know, if people want to leave and work other places, that's also their prerogative. I mean, Santa Fe is a beautiful place to live. I'm wondering if there's other things that they're talking about to try and have, to try and keep officers, or in the alternative, like what we're proposing, that we actually have alternative units. So we may not, you know, the different kinds of police officers, perhaps if there were different kinds of police officers, we'd have more people applying for those positions because they'd be different. And, you know, it's an interesting thing, right? That maybe I don't know. I think it's worth a conversation, but interesting.
Yeah, we've had that conversation for a while, Monica, when I suggested that police officers may have different roles and may look like social workers or do social workers. And that was never supported. And I was laughed at when I first got on the council. And it's still kind of that mentality. What's happening is the people that are having different roles are coming from the fire department, not PD. And that is what I think you're right, to like think about different ways that people have in their jobs in the PD specifically as it relates to alternative responses. I still think that's an important conversation. So thank you.
Right. And maybe it's fine that some people leave and that things sort of shrink naturally. Because, you know, it's difficult for me to sort of fathom that, you know, that fire wouldn't be also offered down payment assistance, or various other types of professions wouldn't have access in that way, because they're essential and we need them for our.
Well, it is emergency responders, so it's EMT, fire, and PD only at this point. But yeah.
EMTs.
Mm-hmm.
Beautiful. Any other questions regarding these updates? Okay, Chris and Renee, you feeling complete with updates from the co-chairs? Or we good to move forward?
I think for now,
Okay.
I'm sure I'll remember something in 30 minutes.
Yeah, and then you chime in again. Absolutely. Well, from my end, before we go into Emily's presentation, I wanted just to have a quick check-in with upcoming, scheduling upcoming presentations. I know Ithaca was in the books. Marcela, I believe you and Mary Louise were going to do an expert panel, if I'm correct, fines and fees with Monica, and an expert panel, I think with Connect. So just sort of giving a gentle reminder to keep us updated via the work plan or via email when you have a confirmation, so that helps us inform the agenda for the next meeting. So that's incredibly helpful. Thank you.
Valeria, can I give a quick update on Ithaca? So I had a frank conversation with Faith, who is from Ithaca, and it sounded to me like she was a little embarrassed because all the work that they did doesn't look like it's going to be passed or utilized by their governing body. And I told her, look, we're not concerned about really what the governing body does. We just want to know about the process. We just want to know about the community engagement piece. So that made her feel a little bit better. So I'll continue to be in touch with her and see, and, you know, I'll give them, I think, one more opportunity at our second meeting in May to decide if they want to do it. And if not, then I think we'll move on from those efforts.
Thank you, Chris.
And Valeria, I did put in the work plan when I would be doing the first presentation, and then it's followed by the expert panel. And I've confirmed with folks, so it should be that we're okay, and we'll have a group of people from around the country that will come. Similar to some of the same people. So our city councilors, they'll recognize some of the folks, but it'll be new for everybody else.
Beautiful. Thank you so much. Awesome. So I'm complete on this end. So Emily, I pass the baton over to you. So take it away, my friend.
Thank you. Hi, everyone. Excuse me, so I clear my throat. So in the spirit of these presentations, tonight I was just going to ground us in the starting to think about alternatives to policing of drugs, right? And so that it would be followed up with an expert panel. However, before I decide who's on that expert panel, it'd be great at the end of the presentation to get a sense from all of you of what resonated from this presentation, what issues you'd like to hear more about, and instead of me just saying, here are some alternatives I think we should hear from. So keep that in mind as I start walking through the presentation. I also want us to just remember that our role is not just about public safety, it's public health. And in my view, public health is public safety and public safety is public health. So you will see some ideas in this presentation that aren't necessarily related to the police department, right? They are about community supports, but I think that that's also under our purview to think about other ways to improve the health of our communities that then will ultimately and hopefully lead to less interaction with law enforcement, so that we're really treating it as a health issue and not as a criminal issue. So I'm going to share my screen. Let me know if you, so you're seeing the main. Okay, great. Let's see, how do I, there we go. So I just want to take a moment to remind us that drug possession and drug use has a huge impact on our everyday and our community and all of our systems. So I wish I had all this data for Santa Fe, the city of Santa Fe, but I think if we started to dive in, we'd see some similar patterns, not necessarily. So I just want to give the caveat that this is not necessarily what we're experiencing in Santa Fe, but maybe these are some data points we might want to think about collecting. But drug offenses are the leading cause of arrest in the US. That's crazy. And if we look at that, the majority, probably about 80%, are for possession alone. So think about that in the sense of, if someone possesses drugs, is that a public safety concern or not? So just keep that in mind as we walk through. Obviously, it has an incredible impact on how many people are behind bars or on community supervision for drug possession. And, you know, including just all of the individuals that get disproportionately impacted by the policing of drugs. You know, for example, in 2019, you can see at the bottom of the screen, ICE made over 67,000 drug arrests, right? And how many of those individuals are there and are then deported? So it was right behind illegal entry that drug offenses were the most common offense in which people were deported. And Marcella, you might have really more context around that, but what we see at a national level are the communities that are being most harmed by the policing of drugs and not the health approach are communities of color and low-income communities. And it has an incredible financial impact. So you can see how much we're spending just for policing the possession of drugs. And it comes at the expense of other types of services and vital supports. Just like we're having the conversation about budget, right? If we're going to be putting more money into the policing of certain issues in our community, it takes away then from the needs or the opportunities to reinvest back into health-based services and social supports. Policing also has an incredible impact on our overdose crisis in this country. And, you know, this 92,000, those over 92,000 people died in 2020 from a drug overdose. 2021 data shows that it's about 100,000. And so we're seeing just this surge. There's also some recent data showing that young people aren't necessarily using drugs at an increased rate, but they're dying of overdoses at an increased rate. So that tells us something about what we're not doing. And that is, we're not prioritizing education and prevention. And we're also dealing with very dangerous adulterants in our illicit drug supply. So I believe that the criminalization of drugs is actually driving part of the crisis, because when you criminalize, you really push people back into the shadows. You create this incredible stigma so that people end up using alone because they are afraid of using with others. They don't seek treatment and supports. And so the more we criminalize, the more we're pushing people away from a health-based system. The other thing we're seeing is that climate change is actually causing more illicit substances to be synthetically derived. So, you know, poppies, for example, aren't being grown as much. So we're now seeing sort of these synthetic opioids becoming much more prevalent. And also it's easier to bring those types of substances into the country or to manufacture them here. They're in a smaller quantity, they're much more potent. And so if we are criminalizing, we're creating much more potent drugs and we're pushing people away from treatment. The impact doesn't just, the policing of drugs doesn't just impact our public safety systems or correctional systems or, you know, police and DAs and public defenders. It has a huge impact on every aspect of people's lives, right? From housing, public benefits, child welfare, employment, immigration, education, right? So the tentacles of this approach of criminalization ends up impacting many of our civil systems. So for example, you have, you're unhoused because you have a felony on your record for possessing small amounts of drugs, and you're not, you can't access housing because of that felony. And therefore, because you're unhoused, you're going to have so many more complex issues and might be using drugs more because you're scared you're going to freeze to death in the middle of the winter. And you're trying to stay awake using methamphetamines, right? You have maybe, you know, compounded your behavioral health issues. So we're seeing just sort of the tentacles of this, or the impact of policing our drugs into every aspect of our lives. And I'll talk a little bit about that, but I think it's important for us to realize that it's not just in our public safety system. Just providing like a little bit of data about what's going on in the city, in Santa Fe County. And it's really hard to get updated data on a lot of this because many of this is based on 2019 or 2020 data. We're a little bit behind, but I do want to flag here, this is data that Human Services Department put out in 2020, that at the bottom of this table, you'll see drug overdose deaths, deaths by suicide. You know, those are significant here in Santa Fe County, and they're increasing. Poverty rates, food insecurity rates. So, you know, Santa Fe is not exempt from the overdose crisis. In fact, we're seeing it increase in our own community every year. And I also am just providing this, I'm not going to walk through it, but I'll share this presentation. This is actually 2018 data, but what I thought was really interesting is that it broke out by race and ethnicity. And recent overdose death data, it really does show that our Indigenous and Native communities are experiencing overdose deaths at higher rates than other communities. We're seeing that nationally, and I think it also shows just the disparity in the impact of problematic drug use in our own county, that you can see some of the differences by race and ethnicity. So, as I mentioned, I think to this group, I asked Santa Fe Police Department for some data. What I thought I'd look at a 6-month period. So I asked for any report that had a drug or narcotics violation for the period of July through the end of December of 2021. And so I got a list, I think I talked about it, but it didn't tell me much, right? Because I really wanted to dive in. So yesterday I picked up from the police department $97 right here of copying fees. I have every report so I could actually read the reports, because there's so much that gets lost in just the aggregate data. And I have to tell you that I haven't gone through all of it, but I wanted to just give a summary of what I've been able to sort of tease out from this. And I think it's fascinating, and I'd really encourage all of us to dive into some of these police reports, because it gives you a sense of what's actually happening but I also have to say, these are police reports, so this is the opinion, this is what was documented by law enforcement, so we don't know what the other side is. I also want to say that this is what I have seen in the reports, and we know that every case is very complex. So I'm not trying to make assumptions here, but I do want to just provide some high-level summary. So there were 60 drug narcotic violations in that period of time. I haven't actually looked at whether that is, it feels like a small amount actually over 6 months, but I know that COVID has had an impact. And so it would be really interesting, and at a later date, I'll look and do a comparison of whether that really changed over a 6-month period. I have data from like 2014, and whoops, go back. So I'm going to just do a comparison. I'm interested. But what I thought was interesting was that half of those violations were drug or narcotic violations alone, right? They weren't associated with any other crime. However, within that 50%, some of them did include warrants. And I just want to flag that, because I think that's really important for us to think about, is that oftentimes someone is stopped because there's an outstanding warrant, and then drugs are found. And that creates a new crime. So they're booked. Not only are they arrested because there's an outstanding warrant, while they're patting them down, they find drugs, or they find drugs in the car. That person is then charged with a new drug crime, and the cycle starts all over again. And why? It's probably because failure to appear or failure to pay fines. And thinking about Monica's work, if someone is unable to pay a fine or fee and there's a warrant for their arrest, and then they find drug, it's just, what are we doing? It's just this cycle, in and out, revolving door with warrants and drug arrests. And people aren't getting the social supports or the treatment or the health services that they need. So diving a little deeper, 70% of those violations, it showed on the report as the primary charge. So there may have been some other charges related, but drugs were the primary charge. And you'll see when and I like having Monica here, because she can clarify, being the public defender, she can share with us like what that means. But You'll see on like a report, for example, at the top here, they'll put what are the primary charges. So 70% were drug violations. And in my opinion, only a third were related to what I'm saying is a more serious public safety charge. So that's, we can all define what we mean by serious, so this is just but what I put in that serious category was assault, vandalism, weapon violation, stolen property or burglary, breaking and entering into a car, DUI, and arson. I felt like those might to the public seem more like a public safety concern than just possessing drugs. And so I thought that was interesting. So
Emily,
yeah.
Can I just say
What is
one
that?
thing, which
Yes.
is the irony just about that is that assault in general, people think of assault as very serious, but assault is actually a petty misdemeanor. You're not touching anyone. There's no actual contact. Assault is, assault can be a variety of things, but assault doesn't mean you touched anybody. Nobody's hurt, nobody's injured, and it's seen as the lowest level crime that we could possibly imagine in the criminal code. But I know that the public certainly feels like assault is something much larger than what it actually is under statute.
Great. And I should clarify that I put assault as sort of a general category. So there's aggravated assault, battery on a household member. Those are all in that category, which might, Monica, be slightly different in severity, correct?
Those are different. Yeah. Battery, battery means somebody was touched, but also under New Mexico law, battery is also a petty misdemeanor. So if I actually punch somebody in the face, that's, and we're not related, there's not the household member issue, that is a petty misdemeanor, depending on their injuries.
And that's really interesting, right? So let's put that in context. Like, so if there's a battery on a household member and maybe someone was struck, that is less of a charge than possessing a trace amount of heroin or one pill that you have on your body that you don't have a prescription for. So again, where we're putting our priority and how we're harming people for their sort of the lifelong impacts that person will now have because they have a felony. I just want us to think about that when we're thinking about public safety resources and what we're considering more severe. And I'm not saying that, but I would think that most people would think if someone was actually harmed physically by someone else, that might warrant a call, maybe, versus someone who's just walking down the street, looks suspicious, and then drugs are found on their body, and now they're a felon. So that's a good segue into, I've started to read through these reports and sort of flag ones that I thought, let's think about, do we really need a law enforcement response for these? And now that we have the ARU, we have the Thrive program, I'm not saying that all these cases should have gone to ARU. I'm not saying why weren't they, but I think it warrants us to take a deep dive into seeing what types of cases are going to ARU, which ones aren't, and why. And I think that's, again, this was 2021, so it'd be interesting to look forward as these programs start to be implemented at a more aggressive level. But so here are some examples. There were a lot in here of people who were asleep or passed out in a car, and someone called, to do a welfare check. And so one example, a man was asleep in his car. He gets out of the car. He throws up on the side of the out the door. Then he gets out of the car, and he actually uses drugs right in front of the officer. They arrest him and book him. To me, that is just a health issue written all over it, right? Like, the guy didn't harm anyone. He clearly is in a very serious condition. This would be, in my opinion, again, this is from what I gleaned from a report. In my opinion, this would be a good example of why did a police officer have to do the welfare check? Couldn't there be an alternative response for that individual and then linking that person with healthcare and social supports? Anyways, again, I don't know all the details of this, but that's one example. There are many more people passed out at a gas station, in parking lots. And we have to remember, this hasn't happened here, but when we're talking about the concern around a violent encounter between an individual and a responding officer, there was a case, remember this case where the man was asleep in, I think, a fast food parking lot, and he was shot to death by an officer. And many say maybe that no one should have called 911 to get an officer there. Could there have been a different response? So I'm just sharing these stories that in other places around the country, things could have gone, or here, things could have gone a lot worse based on what we're seeing elsewhere. Another example, a woman refused to leave a hotel room. Law enforcement was called, an officer responded, found narcotics in the room, and arrested the woman. Clearly, based on the report, she had some very serious mental health issues. She was aggravated. She refused to leave. That might be another example of having more of a behavioral health crisis response than arresting. This other one I found interesting. An officer was driving, and I don't know why, and so Monica can also maybe jump in here, but decided to query the license plate. Like, why? There was no reason documented in the report that the officer would have typed in the license plate. He found that the plate didn't match the car, and so pulled the person over. That car was not stolen. It was a little unclear about who owned the car, or, that was a little weird, but no crime seemed to have been committed by, this man driving this car. They found drugs in the car because they saw some foil, and the man was arrested. And that was the only crime that was noted on the report. He had his elderly mom in the car. Anyways, Monica.
Do you remember, I mean, this is, so there's, sorry, my dog is going a little nuts because it's 6:15 and there's probably a bunch of other dogs walking. But these are things where, my questions are, what the vehicle look like? Was it kind of beat up? If the vehicle was beat up, sometimes what happens is, and sometimes officers would look at this as proactive policing. The other thing is that, sometimes they make stops, they're called pre-textual stops, right? So they're making a stop for another reason, which usually means they want to look in the car or the person's body. So they sort of look for different reasons why they could pull somebody over. And maybe this was the case. My question would be, did this person have a lawyer? Were they fighting this? Did the license plate really not match the car? There's other sort of things that could happen here. But that's one of those things. There are a lot of states that have license plate readers. We had some good case law that then, well, depends on how you look at it. We had some case law that went one way for a while, but now the New Mexico Supreme Court has decided that certain things are lawful. You can sort of look at insurance and registration stuff if you have that kind of technology access. But there's certainly people that make arguments that there's a privacy concern and that you shouldn't be absent some other behavior or actions, that law enforcement should not be essentially checking everybody's license plates for these reasons.
Gotcha. Marcela, go ahead.
This is a question probably for you, Monica, but I was stopped by a state police officer in northern New Mexico coming back from Colorado. And I, of course, am trained to say, why was I stopped? And he said, because my reader, and he said, because you have a suspended license. I didn't know I had a suspended license, and it wasn't my fault. It's because they didn't register me paying for a ticket. And so I got it all cleared up. But I did ask what led you to query my driver's license? And he said, I didn't. I have my car alerts me, or I have a reader. And this probably happened about maybe it was before the pandemic. So it was like 3 or 4 years ago. And it was the first time I had heard that state police had these readers. Is this true? Was he pulling my leg? And then I inquired, and sure enough, I was just shocked that they didn't need a reason to put my driver's license information in, but he said that it read it. I don't know if the state police have this technology. It would be good to know. Do you know, Monica?
So I've never had a license plate reader case before, but there's a lot of technology that law enforcement is now using for a variety, which for different types of surveillance, if you will. It being automatic, I haven't heard about our police having something that they have no control over. There still has to be some initiation. It's not like the car is reading every single license plate that it goes by. That doesn't make sense, because if they're in traffic, for example, there's so many license plates. I don't think that we have that technology. I could be wrong.
I just want to add that I was stopped twice on the same trip for the same thing, and the second officer told me the same thing.
Right.
So I don't know what we have.
You're so unlucky.
My regular car. It was like a rental car. Maybe that was.
It was a rental car, and you were coming from Colorado.
Yes.
So I will say
That's true.
Pre-legalization.
Yes, pre-legalization. So also all of those things are legal. However, this is what comes into the sort of profiling that occurs. And I'm not saying racial profiling, I'm saying profiling of vehicles, right? And when they're going to pull people over because they really just want to search the vehicle. They want to search the car. And also, I'd love to talk to you about your suspended license, because this is one of those things that we want to change, right? Is that you can get a suspended license unbeknownst to you because you paid something, but they didn't register that you paid it. So actually that's a failure to pay issue. Side note.
So there you go.
I was just happy they didn't arrest me because they could have.
Well, the only reason they didn't is because they changed. Well, this was actually Representative Momaestas who had a bill that changed. It used to be there was a mandatory minimum of 4 days in custody for a suspended license. For a mandatory minimum that we are going to say that. So you could, child abuse, for example, most people think that that's pretty egregious, of course, right? Child abuse does not have a mandatory minimum. Yet if you drive on a suspended license, even if you have no idea that it's suspended, that has a mandatory minimum. And I'm not even talking about revoked licenses. That's separate. But there was a law that was changed that it's an administrative suspension. So now they can't arrest you. It's more that they just couldn't, because they would have. And you would have been in custody for 4 days.
So, I mean, just an example of how complex and interconnected are these cases are, right? From failure to pay all the way to profiling a car, to ending up arresting someone who might really need health supports and not being incarcerated. So I just, I'm going to read through all these. The last one I thought also was interesting. And the reason it jumped out to me was, really, should we be spending our time, our law enforcement time, on these types of interactions? It also is another flag, just like the one of the person passed out in the car, that could have gone wrong, right? Can only imagine what could have happened. So officers were walking through the parking lot at Home Depot and apparently looked in a car, saw something that looked like drugs, stopped to talk to the person. The person freaked out and fled on foot. They chased and apprehended the individual, who ended up falling and scraping their knee. And they asked him, "Why did you flee?" And he said, "I'm terrified. I've never had interaction with law enforcement before." So here's this poor guy sitting in his car in Home Depot. He has illicit narcotics, but just because law enforcement approached him, he fled. Could you imagine if he had reached into his pocket, if he had done something that law enforcement may have thought as a threat to them, he may not be alive today. And again, we see these same types of interactions going wrong all over the country. And so I want to flag these because the way we police drugs is often a pretext to harmful encounters with law enforcement, right? So oftentimes it's, oh, well, I smelled marijuana in the car, or if it doesn't have to do with drugs, that person didn't have a operating brake light and I stopped them and they end up getting arrested for possession. So anyways, I will continue to share if anyone's interested. I now have this stack of reports. Happy if you want to read through them or join me in doing this sort of more, I guess it's a qualitative review than a quantitative review of what we're seeing in Santa Fe. So, and I also do want to say that drugs are illegal under state law, and law enforcement is doing their job, you know, that they are policing, they're told this is illegal and therefore they are following the state law. And so later in my presentation, I promise it won't be too long, I do want to talk about ways in which our city can start policing in a different way, even though the state law says that possession of illicit substances is illegal, because I think there are some ways that we can do things differently. So really though, I do have to give huge kudos to our city because we have been a leader in drug policy reform at a local level. And so just to flag, back 2014, our city became the first city in the state to decriminalize small amounts of marijuana. Our city council did that with a council vote, and now obviously we have legal cannabis, but that was a really big step. Even though cannabis possession was illegal at a state level, the city of Santa Fe changed an order, it passed an ordinance making it, decriminalizing it here. We started the law enforcement assisted diversion, the second in the country in 2014. That model was really about, it was sort of de facto decriminalization, right? Diversion into a harm reduction health-based system instead of arresting people for possessing opiates. We created the Municipal Drug Strategy Task Force. Again, very few jurisdictions in the country had done something like this. Ithaca was the first. Marcella served on that task force that ran for 2 years. We presented some of those recommendations to this body earlier this year, or was it early or last year? I can't remember. And so many of the issues I'm going to touch on actually were recommendations that came right out of the Municipal Drug Strategy Task Force. We have the Alternative Response Unit. It is also looked at as a national model because a lot of other communities don't have ARUs like we do in Santa Fe. And most importantly is that we have an ARU that does not include law enforcement, right? And so that's a really important model to look at. We have the hygiene unit. Kira's department has created, I think it's showers for people who don't have access to bathrooms and showers elsewhere. And so that's also, I think, a really important step forward for the city. And then in 2021, our city council banned no-knock warrants. No-knock warrants are where police get a warrant to, and this is really driven by the war on drugs, to try to get evidence in a drug case. And they, but they don't have to knock. They just burst in a SWAT style raid, and oftentimes people then are injured or killed that have nothing to do with the raid or the raid. And so again, a really important change, I'll talk about it in a little bit. So moving on, I just want to talk about sort of the areas that this body, this task force could explore as we continue to do our work. So the first, that's around decriminalization of the possession and related offenses, shifting police responses for drugs to a more appropriate civilian alternative. We're already doing that. That's why you see that little check mark. And we've heard from the ARU folks, how can we make that even better? How can we expand it? How can we advocate for more funding? How can we get it evaluated so we actually see the impact, et cetera? Expanding harm reduction and other health services. I think this is an area where we can do more in our city. Talking about that tactical and personnel reforms to prevent drug war policing. Again, that's the no-knock, the ban on the no-knock warrants. I think we can do more, and I'll share a little bit about that. I talked about the uprooting the drug war from civil systems, and then where can we maybe think about data collection and transparency that will help us track how we're doing in our local community. So quickly on decriminalization, basic principle is treating problematic drug use as a health issue instead of a criminal one. Oregon became the first state in the US to do this 2 years ago, and it's just getting implemented now. So possession is no longer a criminal offense in Oregon up to there's a threshold amount. It is a civil infraction. And I just want to remind us that any possession of a Schedule I narcotic and Schedule II, even in trace amounts, is a felony, aside from cannabis. So that is punishable up to 18 months in prison and a fine up to $5,000. So if someone is patted down, they have a syringe, they have trace amounts of heroin in there, if they have a little bag in their pocket that has shards of methamphetamine, they have one fentanyl pill, half a pill, they've now committed a felony. So how could we do this? The idea is really to enact a non-enforcement policies, or like lowest level law enforcement priorities for law enforcement of the possession of drugs for personal use. You know, and then also decriminalizing other offenses like homelessness or loitering or public intoxication or public nuisance that often go hand in hand with the possession. So I just want to throw that out there as people are starting to think across the country and local jurisdictions. This is an idea that has been raised. And then you'd have to actually draft and train, protocols and training materials, because what we saw when we decriminalized marijuana in the city of Santa Fe, I don't think early on did we do a good job in training law enforcement around what that change meant. So here's an idea of expanding it to all drugs. Health-based approaches. I don't know if folks on this task force have heard of supervised consumption services, or otherwise referred to as overdose prevention programs. But the idea here, and I've provided a link for those who might want to watch a little video to get a little primer on these types of health centers, is that they provide a legal safe place for people to bring their drugs and consume under the supervision of trained staff. There's no fear of arrest. They have access to harm reduction services, to sterile equipment, to naloxone, the overdose reversal medication for opiates, drug checking tools. But most importantly, these centers become bridges to other types of social supports and health services. And so this is a model that has been in other countries for decades. We have reams of data and evidence to show it works. And most excitingly, that we have New York City has opened up 2 overdose prevention centers. They've been endorsed by their mayor. One's in East Harlem and one is in Washington Heights. And that they opened up early in 2022. I mean, the data is astounding how many people go every day into these safe spaces. They have become places, really important community spaces where people feel safe, where people can access other services, where people are not afraid to die because they're using a substance that they don't know the purity of or what's in it. And I've been in contact with the folks who run these overdose prevention centers. They're more than happy to come. So this is an example of where we could have an expert panel. They're more than happy to share and to support the work that we're doing in Santa Fe to see if this is something that's appropriate. Again, it may not be we're talking about New York City, right? Where people can easily access these centers. But could we have a mobile unit? Could there be an interesting way to integrate a program like this into existing services in Santa Fe? The other thing I just want to flag is that this New York City's Park and Rec called the program because they have a program to pick up used syringes in the parks and on the streets in New York. And after these prevention centers opened up, they got a call and said, "What's going on? We're not picking up as many syringes. It's really weird." So it's also having a really positive impact on the community, and in my opinion, a public safety impact for our community and a public health impact. So drug checking, I mentioned. Thankfully, in our last legislative session, New Mexico decriminalized drug testing equipment and supplies in New Mexico. Previous to this year, they were considered paraphernalia and although they were a civil infraction, they were still illegal to possess and to give out. Now they're legal. So for example, a fentanyl strip where people can test their drugs to see if fentanyl is in there, or there are other types of drug checking supplies to say, okay, did you actually, I think I'm taking methamphetamine, but instead I got heroin, or vice versa. I will say that in looking through those 60 reports, most commonly the drugs noted were methamphetamine and fentanyl. I think that's really interesting to see, because that's been a real shift from 10 years ago in the city, where we saw much more an increase in heroin than we did other drugs. So there's really definitely been a shift. And we know that fentanyl is basically in almost all drugs now. And so there's a real chance for some real harm if people don't know what they're taking and how much of it. So anyways, drug testing programming, local jurisdictions could facilitate a program to check drugs in this, it could be part of the supervised consumption space. We could distribute supplies. So here, again, just some ideas. I'm not saying this is what we should do, but maybe we should learn more about it. And also, I just want to share safe supply. So there's a lot of conversation around the country about, okay, people are taking drugs, they have no idea what's in it. There's fentanyl, there are even, there's carfentanil, which is even stronger. There are other drugs that, xylazine, for example, which is used in veterinary practices it's a horse tranquilizer, and it's being cut into fentanyl because fentanyl has a much shorter life or half-life than heroin does. So people don't like that their high is so short. So xylazine actually extends that high, but what people are seeing is that it's causing really scary skin lesions, not even in the places where people are injecting, if they're injecting. So we're seeing a really scary illicit drug supply. In my opinion, it's just going to get worse. So the more we crack down on one substance, so for example, in Colorado, there's this bill that's going through the legislature there that will re-felonize fentanyl. They're really targeting fentanyl They're mandating people into treatment. They're creating drug-induced homicide crimes for anyone who might have even shared a pill with someone else. And if that other person dies, they can be charged with homicide. Scary kind of enforcement without, well, they're also putting money into harm reduction, but so that's the irony there. But I'm scared we're going to start seeing a lot of states cracking down on the substance of the day, right? And so what happens in an illicit market is you crack down on fentanyl, it's whack-a-mole. It's like you press down on one part of the balloon, you're going to see a bubble come out. So more dangerous substances, they're going to tweak the chemical makeup of the substances. We'll deal, and we're going to have another drug on their streets that are more potentially more dangerous. So there's conversation about how do we ensure people who are using drugs get what they're wanting and expected to get. And so I thought this was really interesting. In Canada, they have what's called a compassion club model, where they obtained street drugs and they tested the contents of those drugs and they returned them back on the market in packaging that clearly labeled what was in it. So people felt safe about what they were using. And no deaths occurred as a result of that. I thought that was a really interesting, innovative way. You may have heard of heroin-assisted treatment in other countries. Again, being, this is a model of decades where people are given prescription-grade heroin and they come into a clinical setting. They know what they're getting. Their social supports are wrapped around that person, and you see a decline in the negative impacts of purchasing in dark alleys, using potential, drug equipment that might give you a communicable disease, violence that occurs in an illicit market, or drugs that you don't know what is in it. So something to just think about around, I don't think this is something we're going to embrace a year from now, but if we're thinking 10 years out, this might be something. The other thing I just want to note is that the star means that these were issues that we talked about in our Municipal Drug Strategy Task Force. So this is not new. These are ideas that also came out from our focus groups and our listening sessions with community. So just to go back, supervised consumption spaces did, as did drug testing and safe supply. Not naloxone availability, again, something we're doing, but can we increase access? Preventative healthcare and service delivery. Again, many people lack the access to healthcare resources. And again, I think we're doing this in Santa Fe, but can we expand it? Can we coordinate it? These were conversations we had at our drug task force. Emergency housing and access to personal hygiene facilities. I shared about the hygiene unit. I think we've done a great job. The purchase of the hotel on St. Francis, that was much more supportive housing. People could live there even if they were active users. I think Santa Fe's done a great job. How can we expand those types of services across the city? I'm going to go real quick here because I know I put so much in here, but I talked a little bit about the tactical ways that law enforcement police drugs, and one is those no-knock warrants. So, Breonna Taylor, for example, she died because of a no-knock warrant. And she had nothing to do with the reason the police broke down the door. Her boyfriend was terrified, had a gun in the lawful possession of a firearm, and she was killed in that raid. Law enforcement often use militarized equipment and SWAT teams to do that. So lots of communities around the country are talking about how do we really need the use of heavily armed units and local police to go into someone's home in the middle of the night just to make sure we're getting evidence for a drug crime, right? Why are we putting individuals at harm that live in that home, who might be visiting that home, or neighbors? There was a case in New Mexico southern New Mexico years ago. It was about a drug raid, and law enforcement threw a grenade into one of the rooms, and there were babies in cribs there and harmed them. So again, I think we need to ask, under what circumstances do we need militarized equipment and SWAT teams? Maybe if someone's, at dangerous need and harm may occur, I don't know, but do we need to use them to obtain evidence for a drug crime? So thankfully, Santa Fe has banned no-knock warrants in all cases, not only for drug warrants. That's fabulous, but I think it could go a step further in thinking about quick knock raids. So even if the law says you have to knock and announce, well, how long does that officer have to wait before they bust down the door? So thinking about like reasonable waiting times could be an interesting reform to look at. So that you have to wait 40 seconds or you have to wait 60 seconds before you knock and announce, or before you actually enter the premise. And there's a great bill in Congress right now that deals with the execution of search warrants, knock and announce requirements, and the use of militarized equipment and SWAT teams. So there are a lot of really interesting models out there. Again, this might be an opportunity for us to hear from experts. And when I talked about the tentacles of the drug war in our civil systems, and I think we've done a really good job in Santa Fe on some of these areas, but again, housing, employment, immigration, these are areas where we know policing of drugs will have an ultimate impact on our community in those areas. And lastly, some communities are talking about requiring certain data collection and transparency so that the public has access to data on stop and arrest data, on what types of calls for service, are we doing warrants and raids, and if so, what was the reason behind that? Looking at budgetary items when it comes to public safety and public health. And I know that we can access some of that data, but if we could house some of this information in one place, we create a culture of transparency and where the public has an idea of where we're focusing our public health and our public safety resources. So that's a lot. I wanted to throw the whole kitchen sink at all of you. I wanted us to start thinking about like what policing of drugs means for our community and what some of those alternatives could be, how we might be able to build out some health supports so that we don't have our public safety system responding to what is otherwise a health issue. So I just want to note that I hope our community engagement process touches on some of these issues so that we can hear from our community about what they think is the best way to deal with drug use and problematic drug use and possession in our city. What other additional information or research would be helpful for this task force if we're going to be ultimately making recommendations in this area? And what topics that of those I presented today, are you all interested in exploring and hearing from experts on, so I can build out that panel, and or are there other issues that you felt I didn't touch on that should be included? So thanks for hearing that out, and I'm going to stop my screen. We can have a conversation if there are questions.
Well, that was an awesome report, so thank you very much for that. Are there any questions or comments for Emily?
Yes.
Okay, Bruce.
I'm sorry I'm in the dark here, but I guess my light isn't lighting up the room enough. I just disagree with some of the points that were brought up, especially in the beginning, talking about law enforcement responding to people passed out at the wheel or people that are seen doing drugs or alcohol in the vehicle. the main reason you're going to go to those calls is if a person's passed out in the car and a non-law enforcement officer responds, and the person decides to become violent with that responding person, and or they decide that, heck, I'm just going to put it in drive and take off, and they're intoxicated. Now what do you have? You have a person driving around that's intoxicated, endangering the public. So if in that incident in Georgia with the officer that shot and killed that, they were dealing with that subject for close to 45 minutes. He was passed out at a Wendy's drive-up window. Wendy's called. They were the complaint. They were dealing with this guy for close to 45 minutes. I studied this case because I still train police officers or security officers, so we still have to deal with this type of issue. Anyway, they as soon as they started to put the handcuffs on, that's when he realized that he was going to go to jail for DUI. That's when he fought the police officer, took his taser, and ran. Now, the fact that he shot at the officer with the taser over the shoulder, and then the officer returned fire with bullets, that's in question, because once a taser is deployed, it's no longer a weapon per se. But that was an issue that if the police didn't respond, now that ended badly, but if the police didn't respond, what's Wendy's going to do? You know, they're going to send an employee out there to deal with this guy? No. If you send a social worker out there to deal with the man, you know, like I said, if the guy becomes violent or if the woman becomes violent, I had the same issue happen to me personally on Jaguar about 3 years ago. And I'm walking my dogs down Jaguar, and there's a woman passed out in a vehicle, and I kind of questioned her. I said, "Ma'am, you okay?" And she kind of was slurring her words. So I immediately knew she was not of right mind, either on drugs or alcohol, and I'm trying to find out if she's sick. Maybe she needs medical assist. So when I called in the plate, the vehicle description, etc. And I called it in, you might have a medical assist here. Well, apparently there had been previous calls because she took off before law enforcement arrived. 3 squads were right there. So I didn't follow up on the case, but I'm thinking they already had a cue on this vehicle being someone that might be driving intoxicated. So and that person took off, hopefully, and I didn't read anything about it, but that person did not cause anybody to be injured.
Bruce, I appreciate, you bringing up sort of the complexity of these cases.
It's very
right?
complex.
However, I think, the alternative response unit here in Santa Fe is already sort of dealing with those same types of questions. And I think what they shared with us is, calling for backup if they needed it. But oftentimes, I think more likely than not, that person does respond to a team of trained professionals that can de-escalate the situation and figure out. So I just, I
agree with you that ARU unit is the answer.
Right, and that's what I'm saying.
You get more of them, so you have a law enforcement officer there in case it goes south. Because
well, actually,
you don't want somebody being violent with a social worker or an EMT. You have to have somebody there trained that can deal with somebody that becomes violent. Because
my understanding of our ARU now is that they actually don't have a law enforcement. They started with 2 different types of teams. One team had law enforcement and one didn't. And what they found is actually they're having better outcomes with having the unit that does not have the officer on, but can call a backup if they need it. Because people tend to actually get more aggravated or potentially violent because of law enforcement, because there is a lot of that fear. I mean, I think that case we talked about, the man who ran in Home Depot because they've never been in any, never been approached by law enforcement or got terribly, upset. Anyways, I'm just saying that there are alternative ways where it's not just a law enforcement officer responding and therefore arresting. The other thing is, did that person need to get arrested? So maybe law enforcement there may be times where law enforcement responds, but what could the outcome have been different if that person wasn't, the car wasn't on, they were in a parking space, they weren't planning to drive. But
How do you say that though? How do you say they're not planning to drive? They're in control of the vehicle, behind the wheel with the keys.
no, it's
You can't
complicated,
make the
right?
assumption they're not going to drive away.
Here in New Mexico, we have all sorts of fun case law that determines when you're in control of the vehicle and when you're not, right? We have Sims, we have mailman, all these cases, which Bruce, I'm sure you're very familiar with because it's
Actually, Monica, I'm not, because I'm from Illinois. I know a lot of good
right.
Illinois law, but in New Mexico, I'm learning. In fact, I learned stuff from you today. I didn't know assault was a petty offense. That's less than 6 months in jail. How about an aggravated assault? Does that kick it up? So
Aggravated assault is different. And again, assault, you're not touching anybody.
No, I understand that. You're just telling them you're gonna touch them, not really touching.
Yeah,
No,
you
I
don't touch
understand.
anybody, right?
So-
Aggravated battery is different. That's when somebody's actually injured and there's some sort of injury to their, aggravated means that there's different things. Anyways, but
There's a
different,
weapon involved, right? No, I
Well, not
understand it, but
necessarily.
I just have a problem with telling citizens to respond to a vehicle. Because that's the one I'm targeting out. It's a vehicle that's involved, that the person that is doing drugs or alcohol or combination of both is in control of, because if they leave with that vehicle and then hurt and kill somebody, I go by that shrine every day on Sorrells, those 2 small girls that were killed. That's, what if that guy was passed out in his car in that restaurant parking lot and the police came and saw him passed out in the car and then dealt with him there? Those girls would still be alive. That's what I'm concerned with, as far as, I guess I'm pigeonholing that part. But I agree with you, Emily, that ARU unit will decrease, in my opinion, use of force incidents, because you will have professionals there, a professional being the caseworker, psychologist, who is better apt to deal with mental health issues, and just to be able to talk to them better. And I totally agree with that.
Yeah, no, absolutely. And I appreciate that, Bruce, because I think the conversation we should have with our community and ask the question is, what types of things should be appropriate for a police response and what things shouldn't be, right? And so I think that's why I'm bringing up these examples of us starting to think through as a group, but also asking those questions to our community and our experts on what could have been an alternative response. Did police have to be there or not? I don't know the answers in every case, but I think it's something that we should start thinking about.
Thank you. Thank you, everyone. Mary Louise, I see your hand
Is
up.
Bruce
Please go right
done,
ahead.
by the way? Was Bruce?
Yes.
Did Bruce
Oh,
have any
sorry.
other questions?
Thank you, Counselor, for asking, but no, I'm good. Thank you.
Thank you, Bruce. Thank you, Renee.
I just want to say that a police officer coming to a vehicle when someone is not at their best is a trigger. A regular person coming to someone that looks like they are just a regular person, the response is going to be different. I'll give you a perfect example. Last night I went to Walgreens and there were 3 people around this guy that was passed out on the side of the road. He was telling them to F off. They were trying to help him, but he was telling them to F off. I came and I was dressed in warm-ups. And I said to the man laying on the side of the road who was intoxicated, he opened up and said, I have cirrhosis of the liver and I just took some drugs and I need assistance. And I want to say that our triggers trigger us to behave and respond to people in law enforcement based on our experiences or what we know to be true. So I want to go back to a regular person responding to someone on the side of the road that is intoxicated or is has drugs in their system, the chances are higher that someone is going to see you as a human being that cares, and the words that come out of our mouth are going to be of compassion, and they're going to hear the compassion, even if a police officer was trying to be compassionate. Second thing I want to say is that we have to be very decisive on what community comes to answer these questions. And I want to say this because if we get community members that have had experiences in their families that have disconnected with their family members that come from drug and alcohol abuse, they're not gonna come with an open mind to have some updated ways of responding to this behavior. And those that come from understanding what the goal is with this task force and how we want to find solutions, I just feel like we have to be really careful, and we have to be fair as to who is part of the community that we're reaching out to. And that's it.
Thank you, Mary Louise. Go ahead, Marcela, and then Renee. Thank you all.
Thank you, Emily. That was so thorough and sobering, but also exciting about some of the really compassionate ways that cities and counties are dealing with this across the country and the globe. And so it really opens up possibilities. But kind of piggybacking on what Mary Louise was saying, I wonder if you have information, and I know that we're not going to base our recommendations on polling, certainly, but can you just broadly speak to the support for these kinds of programs in New Mexico or in other communities? Was it really hard? I mean, it's not lost on me that places like New York with these two centers are rare. And so is that because there's a big pushback by community, by police, or is there, in an open-ended way, really support for this? Are people looking for these creative solutions and what seems to be very reasonable and sensible solutions to this public health issue?
Yeah, great question, Marcella. So, I mean, yes, we've done polling nationally and locally on some of these issues. I think in general, we see majority support to treat drug use and possession as a health issue and not a criminal issue. I think where you start seeing variations is in the details, right? However, in New Mexico, we see majority support for these types of overdose prevention centers. And in fact, there was a bill that moved through the legislature a few years ago. It passed the House with bipartisan support. It went over to the Senate and got caught in Senate Judiciary, along with, as Monica and Marcel know, everything else we were working on. And Representative Armstrong, Debbie Armstrong, was a champion for that. We have been educating our legislature on this specific program for now 8 years. So many of those legislative members are very knowledgeable about how this could be implemented in communities across Mexico. I will say that the bill basically authorized local communities to open up programs like this. So it gave the local community the ability to decide whether it was right for their community or not, but it gave Department of Health the ability to provide supports and services. Rhode Island, I will note, has done that. They've passed a statewide bill authorizing. So yes, I think we're seeing a lot of support. Where I will say there has been some pushback is because of under our former administration, the Department of Justice said they were not legal. Be under the what's called the crack house statute. So they said that because people were allowing illicit substances to come into a space and to be consumed, that was illegal under federal law. There's a big lawsuit about that. Safe House in Philadelphia actually was the first community to try to open up a site like this many years ago. So they're in a federal under federal litigation. However, what we're hearing is the Department of Justice, the current administration's Department of Justice, is much more friendly, and look, nothing's happened in New York so far, right? The feds haven't come in and shut it down. So local communities, I think, are feeling a little bit less concerned about opening up something like this. And so we're going to see California, there's similar legislation. I will also say that these sites have been operating underground for decades, right? They just haven't been legally sanctioned sites. And so we know that they work. And so I think it's time for us to think about what we could do at a city level that could replicate the things that have worked elsewhere. But I will note that Santa Fe is a small community. Would this be a program that would be more utilized by our unhoused population who can't use drugs in the shelter? So many of those people were, we hear the community getting so frustrated because people are camping on Harrison Road. Well, many of those people are camping on Harrison Road because they are using substances that they are dependent on, and they cannot go into the shelter and use there. And so I think, I'm just throwing that idea out. I don't know, but maybe that's a community that could be best served by a program like this. So I think that many of our community members are supportive. It's just taken a while to get sort of the political will and the comfort to open them.
I would just comment that based on what you're saying, I mean, it's the same with like restorative justice or transformative or diversion programs. People in focus groups or in polling can express a desire for a change, a significant change, but just don't have the information about what programs they're actually looking for, right? Because our culture does not, our public culture and the public discourse doesn't allow for a lot of that information. So I'm really glad that we opened up these meetings to the public and to our other counselors and to other folks at the city. I wish more were participating and present, but I also think that it means that as we develop recommendations, we have our work cut out for us in being able to really help the general community understand. Look at all of these, we're not actually, I mean, we could be, but these are programs that have been tried and that in many places are successful. So we just have our work cut out for us, I think. Thanks, Emily.
Thanks, Marcella.
Thank you both. I believe Renee was next, and then Monica. Hola, puppy.
Oh, so cute. Thank you, Emily, for sharing your knowledge with us, and just all the work that you do on a daily basis, and just the I guess the nuances of things and how we communicate things. It really does make a difference. And so I guess I did want to lift up how Bruce interprets this, because I think a lot of people share the same viewpoint, that we wouldn't want somebody to be in a car, whether they made a decision to use drugs or not, and then hope that they don't drive and hurt somebody else. So I guess I'm curious, in your models or what you've seen as the alternative response, how would then, I mean, one was like someone else would respond to alternative unit, people that look different, that weren't officers. Is there some other idea that you were thinking that other places that they approach it in a different way. So if they see that the person is not in any capacity to drive, what do? Hey, we can take you somewhere else. Or, I mean, I'm just curious, like what would you respond to? Because he's bringing up something that other people would say in their community, the same exact thing. Like, why would you do that? You're going to hurt somebody else, even if they're in their own car. So if it was a police officer, is there like another response that you think they like another way or approach to it? And what would they do as an intervention? Have you heard of any other way to approach that?
Well, I mean, I think that this idea around an alternative response unit is appropriate. I think it also depends on the case, right? We have to, like, is someone, passed out or, in a car that's running, on the side of the road, right? That might be a very different situation than someone who lives in their vehicle, right? Because we know a lot of people are unhoused and they're living in their vehicle and the vehicle is parked in some remote parking lot and, someone's asleep at the wheel. I think that we have to just sort of think through what all those alternatives are. I don't have an answer for that. One of the things is we bring up and we think about that. I'd love to hear from experts in other places what they would do. I'd love to ask the ARU here, like, are there, have they responded to cases like this? What would their recommendations be? I feel like there's a potential for harm in any situation, right? Any of the cases that the ARU goes out on, people say, well, what if the person becomes violent, or what if there's a weapon, or what if, they're in a car and can drive away? I think we need to think through that law enforcement can always be called as backup when there are indications that they need some additional support because of potential public safety risk. So, I mean, that's what I would say. I don't have the answers. I don't know. I mean, and I think we're traumatized in our state by people who are driving and are incapacitated in some sense, whether that's the lack of sleep, whether they're on valid prescription medications, whether that's alcohol, whether that's illicit substances. And so I think it's a serious issue, and I think our community is concerned about it. So I appreciate us being thoughtful for those types of calls.
Yeah, I guess I'm just hoping that like they'll be like, oh, we'll take you here while you sober up, or so that they're out of their car and they're helping them. I don't know. I'm not just, I guess I'm just trying to think of, there has to be some other solution versus being like, you're good, just don't drive your car. And I don't know, do you know what I mean?
Yeah, absolutely. But like, let's take that case where he talked to the guy was throwing up, and then sounds like he might need to be transported to a health facility, right?
Yeah.
Instead of to jail. So, I mean, I think the reason the ARU exists is that there's a paramedic on scene that can evaluate.
Exactly.
That car could be just, they could just say, take the keys and I mean, I don't know. Monica might have a better sense because you deal with those cases all the time.
Real quick, I did that a couple times.
Which, stay in a car while you sobered up, or?
Took the keys and threw them in a porch. When they sobered up, they could find their keys. So, I mean, it solved the problem because I didn't arrest them. So their keys got thrown in where they couldn't find them until they were sober. So
Thanks,
that was
Bruce.
my alternative. That was back in the 80s also. Sorry.
That's wonderful, Bruce, because this is the thing that I will say. I've experienced officers that have approached the issue in a public health way. And when they're approaching, what they've done is say, can I take you somewhere? Where can I take you? Do you want to use my phone, or can you use your phone to call somebody to come pick up the vehicle? And then I will, there are ways that, and again, I want to say, let's celebrate our law enforcement officers when they're trying to find alternatives. And some of them do, right? They'll they'll engage with family members, friends, take that person to the sobering center, take them to St. Vincent's, granted, then the vehicle gets towed and there's other things that are tied to that. But there's so many different alternatives that people can engage in and do. Another one that people don't think about a lot, which is hard, but in so many other states, the way that they've battled DUI is through the increase in public transportation. It's something that we don't really have here, and it's a huge, huge way to cut down on DUI deaths, but it's something that for whatever reason, our state doesn't invest in. If we had public transportation, reliable, expanded public transportation, I'm pretty sure those things would go down and enforcement would go down and officers could deal with other things besides just intoxicated driving. The other thing is that there's all sorts of case law about whether or not they have control of the vehicle. There's so many people that live in their vehicles also, and that's a defense to DUI, but still I've had clients that have been charged with DUI where they weren't even in the vehicle when the officer showed up, but the car was like over there, depending on where the vehicle was parked. The keys weren't even in the ignition. There's so many little factors.
Right.
But I think there's lots of alternatives that we could move to so that it's not just, well, somebody's passed out in the vehicle, we have to arrest them.
Yeah, I think that there's ways again to communicate it though, like so that
Right.
we're not saying we don't want to deal with that because that's low level crime, but to say that we offer alternatives to those situations. And clear about what those are, because people will be like, what are you going to do? So I'm just putting the kind of out there of like what responses we might get when we hear kind of these.
Absolutely. And I do want to lift up that one report I shared about the Home Depot where they chased him. They didn't arrest. And actually, you know, there's so many that I read where they did call ARU, they referred the person to Thrive. They didn't arrest the individual. So, you know, there's a lot of really good outcomes when it comes to people who are struggling with, you know, addiction, who've been caught up with law enforcement, that they actually, you know, did divert people into health responses and didn't. So I do want to share those examples.
Great. I think the other thing that I want to bring up is if we have a panel that they could explain about the intention of a supervised consumption service provider or service location. And you explained some of them, but I guess the question that I would bring up is that just to contain the activities of that person, and there still are a lot of overdoses, or do they see higher levels of rehabilitation of people, you know, getting other wraparound services so that they may find a pathway to for rehabilitation. So I guess that's my curiosity, and maybe the public would want to know, like, oh, you're supporting its assisted overdoses. You're just by giving them a place to overdose instead of elsewhere out on the street. I'm just like putting that out there, like some people would probably say that. So I'm just curious with what they're seeing, if there's anyone in the panel that we can add that could like clarify that, if they see other, like, I guess, success stories and that they found the resources they needed and then there was a rehabilitation.
Absolutely, Renee, and we can get someone, I can share that data and evidence shows that there's a reduction in overdose deaths. There is an uptake in other health services and wraparound services, and they are a bridge oftentimes to treatment. If that person is in the space to want it and can receive it. So it's meeting people where they're at. It also reduces litter from drug use. It increases public safety in those communities. And so it's not just about a safe space, it's about meeting people where they're at so that they have access to the resources and supports. And there is so much data we can share and have experts share on that. So absolutely.
Great. And then the other thing I just want to let you know, we have, you know, even though we put in that no-knock warrant in place, the ban, they also told us that if any other jurisdiction comes in, whether it's sheriffs or state police, that we have no control over, not allowing them for no-knock warrants in the city of Santa Fe. So it's just our officers. So that to me is another piece that we need to improve upon and have the state also fall in line with that no-knock ban. And then the other thing I just want to say is like this presentation, if we're trying to have counselors understand the implications and why these recommendations for decriminalizing drug use or drug, sorry, what are you calling it? The shifting criminal responses to drug uses. How would you frame that? Sorry. What's the, like, how would you umbrella this?
Treating drug use and possession as a health issue, not a criminal issue.
Okay.
Is
So
one
I
way.
guess what I'm wondering, because we are kind of talking and learning with ourselves here about this, and then obviously we want to make recommendations, but would it make sense to have this presentation be at a quality of life meeting where it's recorded and it's accessible to the public, and we go as, you know, participants to listen in too, but that they present to the quality of life members on the council? This is just an idea. I'm just thinking like some of these info sessions, I feel like, oh, should we like, because the only people that are accessing these are actually going to be people that may listen to the recording if they find it on YouTube. But I'm wondering if like that presentation, we'd have it at a quality of life meeting so that there's more public listening in. And obviously we would be able to ask questions, I hope, but also the counselors who will be hearing this stuff in our recommendations, at least they have some knowledge around it. Just a thought. I don't know if you all have an opinion about that, but.
Go ahead, Marcella, and then I'll look to chime in. Monica, did you have your hand up for this round, or was it from the previous one just before we move on?
The previous one. So
Okay, thank you. Go ahead, Marcella.
No, I think we should keep inviting council members. This is its own task force. We're going to have incredible panel presentations from around the country, and we're not going to present those before the quality of life committee. Like, I was
even thinking those too. I'm like, maybe we should keep, I don't know. I agree with
this
you,
is,
Marcella.
you know, we're doing our report, and I don't know, I feel like we've opened up our meetings and we should maybe do it in a way that's different so that it can be public and that it's on the YouTube. I just think that we should make them as accessible as possible to the public and let our counselors know, you know, if you're interested in these meetings, if you're interested in these, and they can always watch them afterwards. I would love to even just create a link to these and then make them available to them in our quarterly report. That's a lot of extra work that we're doing beyond the work that we're already doing.
No, I'm saying that they wouldn't be two presentations. It would be one, and we would have, instead of having a regular meeting, we'd have it at the quality of life meeting so that that presentation would actually reach more people, and it wouldn't be double work. It would be one time. The thing that I'm saying is like, as a counselor that has way too many meetings, I'm not going to be listening to past meetings. I just don't have time. I'd love to hear what's happening in Chris's utilities committee or in other like community related committees, but I don't have time. And so and I don't know how much other counselors who don't have a second job do. I mean, they say they're interested, but no one has actually followed up with like, hey, I want to see that link with that presentation. So I'm just trying to figure out a way to have more people in tune with what we're talking about. So when we make the recommendations, then they remember the presentation we did at Quality of Life, and they're like, oh yeah, I remember that piece. I don't know. I'm not saying double work though. I'm not saying do it at a task force and then do it also at Quality of Life. Maybe do it at Quality of Life instead, but you all tell me. I don't know. I'm just trying to get us more exposure to what we're talking about.
Well, part of maybe what we should do is create a plan instead of just doing it for the quality of life. How do we ensure that the information, because we're self-learning, so we get to, within our committee, ask the kinds of questions that we want to ask, and we open it up, and all of a sudden, who knows where these presentations, this is for us to be able to really think through what our recommendations are in conjunction with the work that Gabe Sanchez is going to be doing with us. So I totally understand why we want more people to see and hear and be on this journey with us, but maybe we should just think more comprehensively of how we do it, how we structure a report back of our recommendations. One of the things that our subcommittee has really, pressed for is, in addition to doing the community engagement process, learning, creating the research, creating the final product, and I'm still not quite sure who's going to create the final product for us, but then we take it back to community to get sort of in a dynamic process input about what our recommendations are. So I just think that we should just create a comprehensive plan to get the community, more community involved.
Can I add a thought on that? I mean, I think it would be great for us to do some individual invitations to council members saying, hey, on this date, we're going to have expert panels on these issues. Because at this point, we're just relying on them to look at the agenda right on the website. And so I feel like then there, let's do some invitations. Let's make it a little bit more public facing, the work we're doing, and maybe we'll get some more participation.
Yeah, on that note, team, on the invitation side, which was something that I think would be relatively easy to do. I'm happy to support with that. Also on the intersection of community health work in relation to other commissions like the Human Services Commission, because they're looking a lot at public health. They're looking at drug overdose. They're looking at data of types of arrests and what parts in the community are the highest arrest rates and that sort of thing. So making an invitation to those folks, because they have funds too that are provided via grants in the community to address some of these homelessness, health issues, so on and so forth. The list is very lengthy, and it does intersect with some of the things that even Emily's presentation clearly touched on very comprehensively. So I can say that I'm happy to support with that outreach and invitation if you like that. Also, there is typically a communication plan that comes that supports council task forces that works with internal communications department in the city of Santa Fe, that there's a newsletter that goes out I forget the name of it. There's different ways that the city can communicate to promote to the community about these meetings, about the presentations that are coming up. And of course, city staff support is critical in that to make all of that happen. But that's not hard to do. It's just having somebody on the inside who can expedite those requests for the task force presentations to be queued up in that calendar, or in that featured in that newsletter, or in that social media post, or in the whatever. So I just wanted to relate that as well. I'm complete for now. Anything else? Back to you, Renee. Do you feel okay? All right. Any other comments or questions?
Monica has her hand up.
Go ahead, Monica.
So mine wasn't related to what we were just talking about. It was from before. So I I was just jotting down a couple notes whenever, people were talking. And I think, to Marcela's point, asking about the support, I think it's really reflective of our state as a whole that this last legislative session, there was so much support for the fentanyl test strips and the drug checking, because people are recognizing how dangerous, like how, how important it is to have a safe supply. And I think, so just based on that reflection, also with and looking at your presentation, I would be really interested in having people to talk about overdose prevention sites, and also safe supply, because I think safe supply can be sometimes a challenging discussion, but it with the way in which we are moving as a state, it seems actually like the next step. And I think Santa Fe could lead the way in that regard. So having somebody really thoughtful to come and discuss that, I think would be really great. And I want to just stress too that we, New Mexico decriminalized drug paraphernalia in 2019, which means that if you have a syringe, even, you know, a spoon or another sort of cook kit, all of these things, these are all things that are no longer criminal under state law. The heart and that has reduced the amount of you know, sort of trash that may be around. But the sad thing is that the hope is that that bill would mean that people would actually keep their syringes, meaning they wouldn't try to get rid of them, because one of the reasons why they're thrown on the ground is because you can get arrested for them. The sad part is that, to Emily's point during her presentation, that even trace amounts, so just a dirty syringe, you still could be charged with a felony if they test it. And that is something that happens, which still encourages people to throw them on the ground, right? Because why wouldn't you get rid of something that you're about to, you know, you could be charged with a felony with? So I think that there's other ways that we can look at this, which is also why the overdose prevention sites are, I think, very timely and important for us to discuss. And I just also wanted to reiterate a really big point that is sort of nuanced, that there's data that shows that these types of sites actually reduce the amount of partner violence. So, you know, domestic violence that occurs between two people that both use drugs. A lot of women rely sometimes on their partners to help them inject. They don't have to do that anymore, and they can go to a facility and actually receive medical care, a variety of other things, and it reduces the incidence of partner violence and being and also being reliant on your partner for those things. So there's so many good things about these facilities that I think could be uniquely useful and helpful for our community here in New Mexico. So I would love to hear from those folks. And I'd also like to say that there are so many case managers, and they shall remain nameless, or nameless in this situation, that do in fact assist people using drugs, help them identify good veins, give them medical care. And to Emily's point about that, these sort of sites are already occurring. It'd be wonderful if they could have additional funding and support, and sort of official support, so they're not just operating in the fringes.
Thanks, Monica. So yeah, I'm happy to work on experts for all of those issues. Are there any others that, you know, the tactical piece is also, you know, around, you know, Renee brought up the expanding the ban on no-knock warrants to be a little bit more broad and maybe a little bit more specific in what's allowed and what's not. So I'm happy to bring experts in that. I do want to say, and I didn't say during my presentation, I got an incredibly fast and comprehensive response from Santa Fe PD for this data. So I just want to thank them publicly for being really responsive and super helpful. And so just want to flag that.
They couldn't waive that $97 fee?
Well, you know, it was more of, I offered that if they could make copies, I'd be happy to compensate like you would under an IPR request. And so I feel like they get asked for a lot of data, and maybe that's why they were so responsive. No, the chief was really awesome about helping get this data. So
our new chief is an awesome guy. I've had some conversations, and I don't know if you saw it on Facebook at all, but they had a meet and greet at the Starbucks by my home on the south side, Starbucks on Cerrillos, near that Walmart near highway. And they must have had 6 or 7 police officers there. The chief was there. 1 or 2 other people were there when I went. So nobody was really there to meet and greet these officers. Maybe if they do that in the future, some of us may think about going to those events and speaking to some of these officers about concerns or stuff. But I talked to the chief for a little bit, what I visited, and I got a good feeling about Chief Joy. I think he truly cares. That's my point. And one other point I want to make, I know I made some statements about your presentation, Emily, but it was put together really well as someone who's done that in the past. It was good, very good. So thank you for that.
Thank you, Bruce. And these are complicated conversations to have. And, I hope it didn't come across that I was blaming law enforcement for their actions. I just think that these were examples for us to think about, like, maybe law enforcement wouldn't want to be the responder to someone throwing up and using drugs and then having to deal with it, right? They may say, I'd rather be dealing with other types of issues. This is not appropriate. So I appreciate, Bruce, you bringing up also just, what the DUI issue and how that gets woven into these conversations. So
just to comment on what you just said, the reason I went to a railroad to be a law enforcement officer is because when I was going through school, I was hearing all about domestics and dealing with, and I'm saying to myself, I'm not a psychologist. How am I going to respond to these calls? And I felt that a better path for me with what I knew that I think law enforcement should be involved in was I dealt mostly all with property crimes in the working with the railroad. So I agree with you. There's a lot of calls and issues that law enforcement doesn't want to respond to and really aren't trained to. And the majority of them are the mental health issues. So I totally applaud this AR unit. Hopefully they can make it larger so you have response not just Monday through Friday, 8 to 5. That it's going to be, if you have a need, and maybe they mix and match it, but obviously a psychologist really always has to be there, because if you're dealing with that type of situation, you need somebody that has expertise in dealing with somebody that's in need of that type of care. So I'm done, Counselor. Thank you.
Emily, I guess after you were talking about the suicides and the number of deaths besides drugs, is there any data out there that's showing that Narcan is actually working and is effective? I hear some stories, but the overall picture, is it doing what everyone thinks it's supposed to be doing?
Great question. Department of Health collects data on how many reversals, overdose reversals were achieved by the distribution of naloxone out of their program. So there's that data. I think we could ask our own law enforcement officers who now carry naloxone whether it's been helpful in their interactions. So, I mean, I think evidence does point to it being incredibly effective. So it's definitely saved many, many lives, but we can try to get that data that's a little more detailed. We could even ask if the Department of Health would come and do a presentation on their programs and their data specific to Santa Fe County. Maybe one of their epidemiologists would do that.
Yeah, and I wonder if the cases where it has been used, if they reverse it and then take them to the hospital and then take them to jail. I wonder if that's the kind of circle of how it's all working out. I imagine with fentanyl and some of those other synthetic opioids that, one dose may not take care of it, and they may need more doses later on. So, but I wonder where they end up after.
Well, there is one tragic case. I know we're so over time, but a young woman who experienced an overdose, was provided naloxone, was taken to the hospital, was then booked into, I think, the juvenile detention center, and naloxone can wear off, and the staff didn't identify it, and she unfortunately passed as a result of, and so, yeah, there's a whole other conversation about harm reduction and treatment in the correctional system. We haven't talked about all those people who can't get treatment in jail and who detox in jail, or the reason that Suboxone is often in jail is because people use it so that they don't have to detox, and the increased overdose death rates when they get released from jail because they use what they went in using. I mean, there's so many, that's a whole other very complicated and important conversation.
Yeah. Thanks. Oh, and before we leave, I just want to say one more thing. Council Lindell did approach me on Arbor Day when we went on the plaza and said that she had looked over the information that Ithaca had sent over, and she found it very interesting. She said she was surprised at how much they were able to do. So she did look at it, or at least she mentioned it. So she's the only one I've heard of, though. So.
Thank you. Thank you, everyone. So next meeting, well, matters from the task force, just to check in, see if anybody has anything. Go ahead, Renee.
Just want to remind our policies and practices working group that we're having our follow-up meeting with the Community Health and Safety Department's director, and also Chiefs Joy and Moya, as a follow-up to our request for information and data that we asked at the end of January. So we're going to get an update on some of the data that we asked and information we asked, and there's some information that I don't think they've compiled yet, and they'll explain as to why. So our meeting's on Friday. Just wanted to remind you all, those of you that are on that working group.
Thank you. Bruce, did you have a question? I saw your hand go up.
That was a thumbs up. I'll be there.
Great. Thank you, everyone. And our next meeting is the 17th. Hold on one second. I just want to check. Mary Louise. Okay, great. There you are, my dear. I thought I saw a hand go up in my little participant window. No? We're good? Okay. Awesome.
What's our presentation for what's the meeting date? May
Yeah.
17th at 5:30, and I was trying to remember who was our presentation, who was scheduled for a presentation.
Yeah, I'm gonna open that, but I think it's finds in, where is my community health? Sorry, one second. There you are. Too many documents open. Okay, so next is, sorry, still loading. I'm gonna take myself off video because my Wi-Fi is a little spotty right now. 1 second, there we go, now it's working. Scrolling. We have May 17th. Oh, we had a placeholder for Ithaca. Chris, I don't know if you can hear us, Chris. But I think, Monica, you said that perhaps if that didn't work out, you would be able to present at that time.
I'm trying to have my sort of general fines and fees close to the expert panel.
Oh, I saw that, yeah.
So I think it's the 21st is for the expert panel of June. And then I can't remember if it was the 7th of June.
It's the 7th. Yeah, you're right. You're right, my dear. Okay, so Chris, we had a placeholder for Ithaca, Reimagining Community Safety, May 17th. But it sounds like that may not be happening. Is that correct?
I'll try to get a commitment for them ASAP.
Beautiful. Okay, so we can check in by the end of the week, and if I will follow up with folks via email if that's confirmed. If that isn't confirmed, then that space is open. Should anyone like to move up their presentation to May 17th or have it be a working session for everyone? Beautiful. Anything else, co-chairs, before we sign off? Or team in general? Should we wait for Chris to come back?
I want a kitty to pet that Emily
I
has.
know.
Have
He
a
was
good
Yeah.
meowing
Therapy
outside
cat.
the window forever. Let me in.
Maybe Valeria, in your correspondence, to ask how people feel about having a meeting in person. Just
Yeah,
saying.
yeah. There
don't
was
know how people feel
conversation,
about that.
right, with Gino, because I think he has a space too. There's Mary Louise says yes.
I don't know if any of you guys are real. I want to know that you're real. I've only seen Renee in person, Chris in person, and Marcela. Those are the only people. So I don't know if you're real. I want to hug you to see if you're real.
We have places to do it where we have technology where people can still listen in if we need to. And at the city, there's a space I was thinking about that we could have a meeting. And if there were some people that maybe want or had to be remote for whatever reason or virtual, we could do that. And then the public could also be virtual. So think about that.
Okay. Beautiful. So I think Chris stepped away. Well, I feel weird closing out without Chris.
That's
here.
okay. He can hear us. He's
Hi,
probably eating.
Chris.
We'll close
you.
out for you, Valeria.
Okay.
Eat well, provecho, bye.
Bye.
Thank you, everybody. Thank you, Marcela. Bye, everybody. All right. Anything on this front, my friends?
The recording
Oh, yes.
and
Let me stop.
post captions, bros.